KTVU, we want to focus today on healthcare disparities for members of the LGBTQ community. Researchers at UCSF have found someone's sexual or gender identity can make them more likely to receive a lower quality of care, often because medical professionals might misgender them or misunderstand their family relationships. For more on the effort to try to improve training in this area, we're joined by Matthew Beld from UCSF's Center for Sexual and Gender Minority Health. Appreciate you taking the time today, Matthew. What are the most significant challenges members of the LGBTQ community can face when they try to seek out medical care?
Thank you, Alex. Well, you touched on a couple of them. Sometimes a patient might be misgendered in the examination room. Sometimes they'll make assumptions about their relationships with their family or what type of spouse they have. And we know that these are detrimental to a patient's experience and pursuing further care. So we created this health certificate program to try and train both seasoned and experienced health professionals and rising students in how to care and best communicate with LGBTQ patients.
And what are the biggest blind spots? What are the steps you're taking to try to better train healthcare workers in this area?
We're trying to stress the importance of pronouns and how to use them correctly and why. We're trying to highlight the disparities that LGBTQ people experience with health and some health outcomes, but why those are happening. It's more about discrimination. It is more about experiences of stress just in our daily lives that lead to poorer health.
And so this is a program, a training program for staff and students at UCSF. Is there talk about trying to broaden this out so that other medical professionals around California, across the country, can also take part and receive this same training?
Absolutely. We're very proud of the work that we've done here, and we would love to roll it out on a national level. We have top researchers and providers at UCSF that have contributed to this curriculum, and we are looking for ways to get that training out there.
Finally, before we let you go, I know that your research that's coming out shows that as many as 40% of people in a sexual or gender minority say they've experienced some kind of discrimination when it comes to healthcare. What are the long-term ramifications of that?
To be blunt, it can be quite deadly. The worst thing you can do at a doctor's office is not go. And many LGBTQ people delay care or just ignore it entirely because they know that they're going to be treated poorly. And they just want to they'd rather avoid that experience than try and take care of their health.
All right, well, it's a really important work you're doing. We appreciate you coming on today to share the work. Matthew Beld from UCSF's Center for Sexual and Gender Minority Health. Thank you for taking the time.
Thank you so much.
Appreciate it. Sure.